Everyone knows that birth control pills are used for, well, birth control. But did you know that as a fertility doctor, I often use birth control as part of the plan? This is confusing to a lot of patients, so I wanted to put together a quick list of 5 important things to know when it comes to birth control and fertility medicine. Number 1, how does it work? Well, what we're actually doing when we give a patient birth control is we are stopping signals from the pituitary gland in the brain that would normally signal the ovary to select and mature a single follicle that will eventually ovulate. We shut those signals off. And the way we do that is by giving very small amounts of estrogen and progesterone. The brain detects those amounts of estrogen and progesterone and thinks to themselves, well, we don't need to send the signal out because the ovary is already doing its job. And so it shuts off those signals and you no longer are prompting selection of a dominant follicle and ovulation. Essentially, this freezes you at baseline, or as if you're on day 3 of your period indefinitely. And that brings me to point number 2, which is fertility doctors and clinics will often use birth control as a way to manipulate the timing of your cycle. Because we can use the pill to hold you at baseline or at day 3, which is typically where we want you to be in your cycle hormonally to get anything started, whether you're talking an egg retrieval, even an IUI cycle, or a transfer cycle. And it allows you to then manipulate the timing of when you're going to do these things and start these things so you can work around important dates in your life, whether it's work obligations or travel. So we capture you at day 2 or day 3 of your cycle. We put you on the pill, and then it holds you there until you're ready to actually start the process, and then we tell you when to take your last pill, and then come in to start. Number 3 thing to know about birth control and fertility medicine is that when you stop the pill, you may get spotting or withdrawal bleed. Now, this is often a source of concern and confusion for my patients because they're like, well, I just got a period 2 weeks ago, and then you put me on the pill, and now you took me off to start my cycle, and I'm bleeding again. What's going on? While you do not have to get a withdrawal bleed, and it's totally fine if you don't have this happen to you, it is very normal to have some spotting or a withdrawal bleed because when you're taking those low doses of estrogen and progesterone, you're essentially kind of building up your lining and stabilizing it. And when you stop that, it is very normal for that lining to break down. Number 4 is pertinent to my patients who aren't trying to conceive, and maybe they've been contracepting for quite some time, decades even, and they've been on this long-term birth control pill, but they want to come in and go through an egg retrieval cycle, usually for fertility preservation, egg or embryo freezing. Now, I've talked about this before. Depending on how their ovaries look on ultrasound and how suppressed or dormant they appear to be, sometimes I will tell patients who have been on very long-term birth control that there could be an advantage to taking a pause and letting it wash out of your system. There are studies that have shown very, very long-term pill use can falsely suppress and give a false impression of how low your AMH is or how many follicles you have. And this in turn, taking a short break of a month, 2, maybe 3 months max, may help you to respond more readily to the drugs. It may require lower doses of medication to achieve the same result, and it may translate into a better response overall and having more eggs available at time of retrieval. Always talk to your doctor about this decision, and remember, if you do take a pause from your pill, make sure you have a good backup plan to avoid an unplanned pregnancy. Number 5, sometimes we use birth control pills for a short course, about 2 weeks or so, in the lead up to a cycle, an egg retrieval cycle, in an effort to prime the ovaries. Because the birth control is going to work to prevent your pituitary gland from sending out the signal like follicle stimulating hormone, this can, in effect, prevent early selection of some dominant follicles that end up growing ahead of the rest and leading the pack. And in a way, we think that in some individuals, it can be helpful to synchronize the follicles to make sure they're all on the same page, and it may lead to a higher likelihood of them growing more closely together. And sometimes this is a strategy that we'll use, especially if the patient had a low rate of maturity in the eggs that were retrieved in a preceding cycle. What else do you want to know about birth control and fertility treatment? Put your questions in the comments.